Hi, my name is Dr. Jade Millay, and I want to talk to you about the most common myths that I hear people talk about when they're talking about diabetes. So this is a common frustration that I get is that we've bought into a belief system of what is possibly causing diabetes, and these are all really, to me, just excuses. So one of the most common myths that I hear is, well, it's inherited, it's in my family. Well, guess what? There is no gene for diabetes. Show me the gene. There is no gene. Now, diabetes does run in families, so it is what we call familial, but is not inherited. So don't buy into the fact that just because your mother or your father or all your siblings have diabetes, that you have to have diabetes. That's just not true. One of the things that we focus on in our office is finding out the reason why this is happening. That's what makes us apart, sets us apart from how other doctors treat this. Another common reason that I find that people say, well, is just, I need to lose weight. Well, that's a myth as well, because I'm sure we all know someone who is skinny and diabetic, but we also know someone who is overweight and isn't. So that really kind of blows that myth out of the water. So if your doctor is telling you that all you need to do is lose weight, well, that may work for some people, but it doesn't work for everyone. So I've even had people where they went to the drastic measures of having gastric bypass surgery and they were still diabetic, even though they lost the weight. Again, the reason why that doesn't work for everyone is because it's not finding out the reason why. Another myth is that all doctors know how to treat diabetes. Now, this is certainly not true because all medical professionals, I've been through nurse practitioner school myself, and I saw the grid, I saw the flow chart. We are all taught the same. We're taught to start with metformin. When that doesn't work, move on to another oral medication. When that doesn't work, move on to another oral medication. When that doesn't work, then eventually everyone is placed on insulin. So don't buy into the fact. You don't really have to go to the best. If you went to the best endocrinologist in town, or even the person who barely graduated from school, they would still treat you the same. And this is the problem that I see with this disease, is everyone is given the same cookie cutter treatment. And if we all look at one another, none of us look the same. None of us have the same symptoms or problems. So why are we treated all the same? Why are we on the same path? Why are we on the same flow chart as everyone else? This is a huge one. Your insurance company has your best interest in mind. Absolutely not. I think we all know this to not be the truth, and it is not the truth with this condition. Your insurance company only will do what your policy dictates. And with this disease, all that they're responsible for is giving you drugs. That's it. So if you're seeking something else, if you want something else, it's not your insurance company's responsibility. It's not your spouse's responsibility. It's your responsibility. You have to take ownership of this problem, and you have to want to do something different. Another common myth is that there's a specific diet for someone who's diabetic. Absolutely untrue. I've worked with several people, and what I should eat may not necessarily be the same thing you should eat. Not everyone should eat the same. So these diabetic dietary classes really are worthless because they're only giving you general information, but not specific information about you. I'll tell you a quick story. I had a patient and he was doing everything right. He was eating healthy as far as what he understood that to mean. He exercised every day. And at the point where he came to see me, he was already on 3 diabetic medications, and his A1C skyrocketed out of the roof. It was at 10.3. And his doctor told him, hey, the next thing for you is insulin, and he didn't want to do that. So that's why he sought other type of care. And we went to work, and one of the major things that we found out that was causing inflammation in his body, which in turn was raising blood sugar, was the fact that he was allergic to gluten. Gluten is wheat, rye, barley, oats. So once we got gluten out of his diet and we fixed some other things, that wasn't the only thing, well then we saw his A1C drop all the way to 5.3. No reason why he should have been considered for insulin. So again, we go a step beyond. We just don't patch your problem up with a medication, but we actually try and find, not just try, but we are successful at finding out the root cause. Once we know the root cause and we fix that, well, we see people get off of medication. We see people lose weight. We'll see people energies go through the roof. but we have to do the work first and not just assume that everyone's the same. Another common myth is that drugs is the best treatment for diabetes. Well, if that were true, you wouldn't be watching this video. I think we all know that drugs are not the answer. Drugs, your high blood sugar is an alarm that something's wrong. It doesn't tell us exactly what's wrong. It tells us that there's inflammation going on in your body, but it's an alarm that something's wrong. And all that drug is doing is squashing or quieting that alarm. It's not doing anything to address the root cause. So if this makes sense to you, first of all, if the root cause has not been figured out with you and you're frustrated and the only answers that you're given is another drug, and another drug, and you know that there has to be something different, well then I would love to have a conversation with you, to sit down with you, look at you face to face, and talk about what makes our approach different. Because when I work with someone, there are a few things that I expect, not that I hope will happen, but that I expect to happen. I expect to see your blood sugars go down. I expect your energy to go through the roof. I expect to help you get you off of medication as much as we can, to help your brain work better, your sleep improve, to basically get you back to life. Because I'm sure a lot of you are frustrated. You're losing out on things. You're losing time from work, or you can't perform your job like you should. You're losing out on relationships because you're so tired, and you just feel defeated. And I know what that feels like. I've seen people in your position, and we've helped people reach health and get to the other side. So if you're interested, if this sounds like something that you would like to talk more about, please reach out to me. I'd be happy to talk to you about your individual problem and see if we can work together to get this problem solved. Thank you.